Perfect. It's time.
Thank you for that.
So it's my pleasure to introduce Dr. Nischwitz Sebastian, plastic surgeon coming from Europe, from Austria, Graz.
Exactly.
And
Thank you very much, Muriel. I'm very honored and glad to be opening this great and very interesting session, and I'm really glad that there are still some faces here in the last session of the second day. I know we're all a little bit tired, but still, you know, these topics are very important for us. We were talking about trust, about transparency, about the future of the aesthetic market, and my talk is titled The Networked Expert, Leading Ethically in a Visible Field. So, for starters, I want to go back to the very early beginnings of humanity. We had hierarchies in all of our groups that we've been in. There have been alphas on top and the omegas at the bottom. There's still some species, many species actually, where it's still the same. And sometimes in our professional work field, it is also still the same. However, from the very first beginnings, man has developed. And what you can see in this wonderful image here is that not only the man was standing upright, he used tools, but also the brain, the skull grew. And that led to the fact that there was much more space for these little guys here, for the neurons. And what are neurons? They are nothing else but networks interconnecting everything else in the body, and without them, nothing works. So, philosophically speaking, one could say that our brain seems to have been built for networks. And how do these networks look like? What are networks? We're talking about like an abstract concept here, or what is it? These are just a few examples of all the networks we have nowadays. So, whatever group you feel attached to, whatever group you are in, is pretty much a network. However, networks are not like a solitary thing. It's not like a mono, you have to choose one to belong to, which is why networks nowadays look rather like this. So we are really interconnected. We know a lot of people in pretty much every situation. What do we have to think about now when we talk about networks in the medical professions? For starters, I want to differentiate, and I just had a very interesting conversation with a colleague right after the last session who told me that some of his patients don't know the results of other doctors and thus are unhappy with his results. And I was like, that's because they only know what is posted on social media. So why do I tell you this? Because we have to differentiate in networks. Are they B2B, business to business? So amongst us, are we talking in a network that is just amongst professionals? Or are we talking in a network that is directed to customers, so towards patients, towards someone else? And these networks, first of all, have to be differentiated, and then you can decide what you want to do with that network, what you want to achieve. They can be used for professional networking like we are doing here. You can become an advocate for public health. You can build trust and credibility, which is among peers and or with patients. You can use it to educate and share information, and also for patient engagement and acquisition. And that, in my opinion, is a little bit of a problem that these networks here have become so enormous that sometimes they dictate our whole lives. And while these social media are a growing topic, this was a search I did in 2024 for a similar talk that I did. We had, when you combine social media and plastic surgery, sorry for the germs, but I'm a plastic surgeon, I found 690 results, and I did that just a few days ago, so 2 years later with 977 results, which is still not an enormous number compared to other things, but it is almost 150% of what we had 2 years ago. So if we talk about the social media, whether we like it or not, it doesn't matter. Is it good or is it bad? Because there are facts, there are studies like these two that define that no matter the age group, no matter the demography, patients oftentimes choose their practitioner according to their social media. So when we go back to these networks, What is the reason that they work? We're not really smart, though somewhat less hairy chimpanzee, and that is the reason why we don't have this pure hierarchical model I showed you in the beginning anymore. But the secret of our species' success resides in the collective brains of our community. So what does that mean? We are talking about collective intelligence, meaning that pretty much no one can know everything nowadays. Everything is so specialized. No one can be an absolute expert in everything. And that is why it is so important to be in these networks, to actually grasp them and to actually seize what you can from them. I like the comparison for the collective intelligence like a Philharmonic orchestra. If you take a look at this, is the Royal Philharmonic Orchestra. They play everything perfectly and it sounds amazing. Everybody in there is able to play an instrument very, very good. But if you listen just to one instrument, it's not that amazing as it is if you hear a whole symphony from an orchestra. Obviously, orchestras can also look like this. A little bit chaotic, a little bit, yeah, chaotic is a good word, I think. And the reason for that may be in the title of this, wanted a leader. What does that mean? Pretty much that there needs to be someone coordinating all these collective intelligences. That there needs to be someone discussing about in which direction someone should go, in which direction all these things should develop themselves. So we pretty much need a leader. And if we go back to the orchestra, we're talking about this guy down here. So if you don't have the conductor, the orchestra is, it's very hard that the orchestra can play a perfect symphony and in perfect synchronity. So the leaders, when we're talking about the leaders, what does it mean? Who's a leader? What is leadership? You always hear this abstract concept of leadership. What is it? Well, the University of Cambridge developed a concept which is called the higher impact leadership, and they describe it as a comprehensive supervision, responsibility, and representation. So if you think back to the orchestra, the conductor is the one who's really celebrated for the whole orchestra's success. And the thing is that the bigger the network is, the bigger the influence is. And these high impact leaders are able to trigger relevant changes on a global level. But to be able to become a high impact leader, you need to be not only able to influence society and economy, you need to be able to improve, to manage your surroundings, but first of all, you have to be able to lead, to manage yourself. And if we take a look at some of these high impact leaders in the world, like the current president, Donald J. Trump of the US, former President Biden, President Obama, my chancellor, because actually I'm German, IMCAS, American Society of Plastic Surgery, and so on and so forth. You always pretty much see the same result here. They are followed, oh, you can't read that properly, that's not so good. Anyhow, the thing is always the same. The amount of followers they have is enormous, while the people they follow is very rare, because that says something about them. And please keep that in mind, because I'm going to get back to that in just 2 minutes when I'm finishing. So let's put this together. The bigger the influence, the bigger the online network. To go back to the social media again, does that correlate? Shareholders' use of current networks was a very interesting concept for me. And for me, medical societies are one of the biggest shareholders of us physicians, of us doctors, because they are able to promote this. They can be the conductor of us doctors. So we did a small study where we analyzed the social media used by European plastic surgery societies. And the results, even though this is quite an old paper already, it's been 4 years ago, are very interesting, because it didn't matter what you did on social media. It didn't matter whether you posted, whether you told stories, whether you shared something. It did not matter. You just had to be present. You just had to have a presence there and a profile. Because, as we've heard before, patients look for their doctors online. And if you're not there, then you don't exist. So it doesn't matter what you do, you just have to be present to be accepted. Another interesting aspect was that we compared that from the European to the US American society, and it was devastating for us Europeans because we were basically not at all present. However, the important aspects of that were that the social networks, and not only the ones online, not only social media networks, but all of the networks that we have, are interwoven. They're very important. The importance for shareholders, for the leaders, for the high impact leaders is undisputed, and they have a core task, that is to engage, educate, and supervise so that everything here happens ethically. And before I conclude, let's get back to this one where I talked to you that the first thing you have to manage is yourself before you're able to manage to lead anyone else. So let's take one more look at one of these high impact leaders, Barack Obama, who's had at this time point 36.5 million followers on his Instagram profile, while he was following 9 profiles. Let's take a look at these 9. All of these are pretty much like concepts or like foundations that he or his wife were supporting back then. So this says something about him. And then I've taken a look at a colleague, let's say colleague, who had in his professional profile was following accounts like Hot Chicks or Tinder or Quickies or whatever. So just think about what that says about that doctor and his ability to lead himself, and then he wants to influence others. So always keep that in mind, that these things are very important, and since everything is so open nowadays, it's getting more and more important. So to conclude, I'd like to say that it's a very thin line between efficient marketing, professionalism, and ethics. It is important, it is non-negotiable that pretty much if you want to be present, you have to be on social media. But when followers overshadow science, we got a big problem. And that is a problem we're facing, in my opinion, more often than not. So, to really conclude, networks are in the human nature. Today's networks are mostly social or online networks. Big reach, influence, and or followers endow you with great power. But always remember, while you create your network, with power comes great responsibility. And we have not even talked about the content yet. Okay. Thank you very much. That's it.
Thank you, Sebastian. Amazing. So, and of course, it's about ethics. So, and we don't have the same rules. It depends of your country. So. You want to introduce the next speaker?
Yes, Dr. Antonio Sison, dermatologist from the Philippines. You're talking about to us about the use of psychosocial screening for the patients. Let's
Good afternoon.
go.
Pleasant to be in front of you. Yes, I'm a psychiatrist and dermatologist from the Philippines, and I also do EMDR, which is a trauma-based form of psychotherapy. My lecture for this afternoon is the use of psychosocial screening in aesthetic and dermatology practice. And just following the earlier lecture, I do not have Facebook, Instagram, or any social media account, and that is by choice. So this is my disclosure. My learning objectives are as follows. First of all, we have to understand, as dermatologists and aesthetic doctors, we're not just looking at skin, but looking at skin-mind connection. Aesthetic medicine and dermatology involve more than just the treatment of skin disease or cosmetic concerns. Skin is a visible organ which is intimately linked with self-esteem, body image, identity, social functioning, duality, as well as emotional well-being. Patients seeking aesthetic procedures often present with expectations, motivations, psychological factors that may significantly influence treatment satisfaction. Research demonstrates that psychological disorders occur more frequently among dermatology and aesthetic patients than in the general population. Body dysmorphic disorder, anxiety, depression, and appearance-related distress are particularly relevant. I will begin now with 3 three major conditions that you may see in your clinic. The first is body dysmorphic disorder. This is when a patient has excessive preoccupation with perceived defects, defects that are often minimal or not even observable to others. Significant distress and functional impairment is also noted because most of the time they are simply obsessed with this small defect. Additionally, repetitive checking, grooming, or reassuring, seeking behaviors predominate their whole waking life. Patients with body dysmorphic disorder seek cosmetic procedures but often remain dissatisfied after treatment. Cosmetic interventions may rarely remove the underlying psychiatric condition. It is primarily a psychiatric condition, but the intervention sought is cosmetic. Therefore, unless it is also addressed psychiatrically, the expectations will not be addressed at all. So when you're seeing patients, some red flags to note would be multiple previous cosmetic procedures. Of course, that will also mean good financial returns, but remember, with that also comes a lot of complaints. There'll be doctor shopping, excessive mirror checking, unrealistic expectations, social isolation due to appearance concern, and disproportionate distress over minor flaws. Aside from that, another would be depression, typically associated with aging concerns, hair loss, acne scarring, chronic dermatological disease, and typically the symptoms may include low mood, anhedonia, anhedonia meaning the inability to feel pleasure or fun in activities normally that brought pleasure, fatigue, and social withdrawal. Since I'm talking about depression, I'd like to differentiate the difference between depression, which is within the normal scale, versus clinical depression. If something bad happens to you, you will be depressed, but that's still considered within the normal range. Clinical depression means it is much deeper and much more chronic, not something that you can recover. At least not like the earlier one. Next would be anxiety disorders. Symptoms include appearance-related anxiety, social anxiety, general anxiety disorder, and excessive worrying about treatment outcomes. So, in order to be able to screen for their patients, I would recommend the following screening tools. One, the Body Dysmorphic Disorder Questionnaire Dermatology version, which has 47 items. It is specifically developed for dermatology and cosmetic settings, and it could be self-administered. It's brief, it's based on the DSM-4 criteria, and screens for possible body dysmorphic. As you can see here, and what is good about it, it has high sensitivity, high specificity, and easy to incorporate on intake forms. The original validation study demonstrated actually 100% and specificity of 93% in cosmetic dermatology second. It is something recommended for all cosmetic consultation patients. Now, for depression, you may use the Patient Health Questionnaire, PHQ-9, meaning it's only 9 items. It actually screens for depression and anxiety. What's good about this, it's brief, it's widely validated, it's free, and it's easily interpreted when you get the scoring. For general anxiety, I would recommend General Anxiety Disorder or GAD-7 because it has 7 items. It specifically screens for anxiety symptoms, and it's also quick and with strong psychometric properties. It is particularly useful for patients exhibiting excessive concerns regarding outcomes. So you have these 3 screening tools. Now, I have to remind you, screening is not a psychiatric diagnosis. The goal is to identify risk factors, recognize vulnerable patients, determine the need for further evaluation, and improve treatment selection. It's also what's important that the screening tools you'll be using in your clinic will be brief, validated, easy to administer, and actually, more importantly, integrated to your routine consultations for all patients. So after you have, during the consultation assessment, you'll actually be evaluating expectation, motivation, psychological readiness, or even including previous cosmetic history. In doing these screening forms, you have risk stratification. You could then identify low risk, moderate risk, and high risk patients. Additionally, for those on moderate to high risk, which is especially if those positive for the body dysmorphic disorder screening and significant depression, anxiety disorder, which actually may also lead you to ask about suicidal ideation, you may now have to explain to the patient that you would need a team to help the patient manage their expectations. That will also include psychologists, psychiatrists, and even either primary care physicians as a team. So the take-home messages would be the following. Psychosocial assessment is essential in aesthetic and dermatology. Body dysmorphic disorder is the most important psychiatric condition to screen before any cosmetic procedure. You have these 3 screening tools to provide rapid assessment for both body dysmorphic depression and anxiety, and screening improves patient selection, satisfaction, safety, and ethical practice. These are my references. Thank you very much for listening. For more information, you may email me. Thank you.
Sorry, you want to do a question now? Yeah, we can do that. Thank you very much, Dr. Sison. Thanks for staying on time. If there are some questions, we can have them now. Yes.
Yes.
Please step to the mic, I think, because of the, or like this.
Hi, Antonio.
Yes.
Wonderful lecture. But
Thank
my
you.
question to you is, I understand there are beautiful forms which will make us understand from a patient's perspective, either depression, anxiousness, or, like you said, body dysmorphic syndromes.
Yes.
How difficult is it then for me to actually present it to a patient? Won't he be upset and say, I've come here for cosmetic consultation, why are you labeling me?
That is a very good question, and thank you for answering it. Typically, what I would recommend, remember, well, for me personally, before they see me, they have to answer 11 forms. That is just for me, for somebody not in social media. Typically, what I would recommend is that before you see patients, do your secretary take history or something like that? No? They go directly to me, that's where it starts. Okay, so basically what you can do, for other, especially in the Philippines, typically the forms are filled up by the nurses. And what they will typically do is that aside from this, the nurse will explain, we would like to have a holistic assessment. So this includes psychosocial assessment. Actually, patients feel more reassured because it tells them this is a meticulous doctor. So, but you'll have to frame it as such. Now, if the patient comes to you with no prior screening, then you will say, welcome, I know you're coming here for this, but part of my assessment is a holistic assessment. This includes this. I would recommend, since these are screening forms, it may take 20 minutes, and you don't want 20 minutes to be eaten up. So maybe before they see you, if you can have like some age, history, whatever you want, and you include these forms, so by the time they come to you, you're already with checking, oh, you want this procedure. Oh, by the way, did you know your score is this, this, and this? And you know what that means. Remember, you're not saying that you're depressed. You have a score. You have an objective score that tells me, is everything all right? I'm concerned about that. The reason why I'm concerned, because if you have elevated scores here, it may affect how your expectations or how the outcomes would be, which is not good for you. So you will have to explain the context of why you're doing this. But from my experience, you typically in the Philippines, they generally do it. But then again, usually they come to me more for psychiatric because I'm a psychiatrist in dermatology. So they're, I think, more attuned because they expect to see a psychodermatologist. But if you're only pure aesthetic or pure dermatology, you can do that. In cosmetic surgeon, does your secretary ask the forms, or you see them directly already? Oh, I see. So I see now what the problem would be, because that will take about 20 minutes filling up the forms.
Absolutely, but I think it's a very, very important question, and I think one way to deal with it is to hand them all the forms, and not you see them and you feel like, there could be a body dysmorphic disorder, and then just hand them the form for the disorder.
It should be
I
standard
think that
for
is
all.
exactly.
Yeah.
Then I think you can
Yeah.
prevent some kind of problems. But what I think is very interesting, how do you deal with them immediately then? Do you still perform procedures directly?
Okay. So
or
it-
sorry, if you have like, do you have a psychiatrist with you, or you do that yourself? And
He did your thing.
yeah. But because you said you have a big team with
okay.
you, that's what I'm
Imagine
asking.
I'm a dermatologist, so I'm seeing the patient, so I have these forms. Oh, there are red flags. You have to explain, because remember, this is like a laboratory result. This is an objective number. And that will be your basis for saying, I am concerned, I have some psychosocial concerns, and I think we need to address this. Would you be comfortable if we refer you as such? Because if we do the procedure now, you may not be satisfied, because not only you have the psychosocial concerns that may interfere with your expectations, and you'll be unhappy, and I will be unhappy if you're unhappy. I think you'll have to frame it that way and to be very gentle versus saying, I think you have something wrong, your body dysmorphic, you go to a psychiatrist. You always have to be in the context of a safe environment and explain that. And also, they have to feel that this is a standard procedure. You're not just targeting me. I'm just doing this because you suspect, I'm a complainer, I might sue you, I'm not happy with this, but rather for all. You might be surprised with some of the results you'll be
Yes.
getting.
We have to introduce that in our practice.
Absolutely.
Yes.
Mhm.
Thank you very much.
Thank you very much.
Okay, we're going to continue with a colleague from the Philippines, Dr. Gail Robredo Vitas, talking about social media strategies in Asia.
Yes. Thank you. So I am the antithesis of Tofi, of Dr. Sisan. He was my batchmate in residency, actually. If he doesn't have a social media account, I have everything. So my lecture, forgive me, I have to warn you, my slides are very whimsical, they're very colorful, you might get dizzy. But that is my personality on social media. So my lecture is on building credibility and patient trust through strategic social media use in Asia. So I have no disclosures. And in this session, I want you guys to understand how social media influences patients, education and aesthetic decision making in Asia. And I want to give you practical strategies on how to use your digital platforms effectively while maintaining credibility and ethics. And finally, recognize how strategic online presence can enhance patient trust, improve consultation dynamics, and even support your practice growth. So opening story nowadays, when a lot of my patients come to me because they've seen me online. Like, doctor, I follow you on TikTok, doctor, I follow you on Facebook, etc. So the first impression actually happens before they even come to the clinic. And this happens quite often now. Patients arrive informed, they've already searched online. They may also arrive misinformed and reassured or confused by what they see online. As we all know, statistics would tell you that everyone has mobile phones. In the Philippines, most of our patients have access to the internet. I'm not sure if it's the same all over, but I do believe that in Southeast Asia, it's the same. Now, how has social media changed the aesthetic decision pathway? Traditionally, patients would have a concern. What they would do is look for a doctor that can address their concern, do a consultation, they get educated by the doctor, and then they make their decision. Now it's different. Patients have a concern, they go online, consult Dr. Google, upload their photos on ChatGPT and Claude AI, and then they check doctor pages, influencer pages, their favorite social media beauty content creator. They save the post, they screenshot, they try everything, and then they come for consultation. And that's when they make their treatment decision. So it's very, very different now compared to before. What are patients looking for online? There's a lot of comparing, there's a lot of research. Is this doctor qualified? Will the results that I do with that doctor look natural? Do they explain the risks? All of these questions. So there's a lot that goes behind decision making. So how did I start? So how did I start from being a dermatologist only to a dermatologist digital creator? So I started with the idea of wanting to educate my patients. Sometimes the consultation takes a long time, and I wanted to give them I guess an idea of what the conditions are. And in the Philippines, dermatology practice is saturated in the cities, and there aren't a lot of doctors in the provinces. So I wanted to make dermatology quite accessible. I started on YouTube making like long form content on acne, melasma, and then I started explaining common concerns in small bite-sized pieces on Instagram. And then I found that, it garnered a lot of questions. So I started debunking myths, correcting misinformation. And then I started showing, what could happen when you do certain treatments. And because of that, I was able to build a physician-led brand. But of course, there are a lot of things that you have to watch out for and think about. So like I said, I am on all platforms. I am on YouTube, I'm on Instagram, TikTok, and Facebook because all of these are different. They target different audiences. So YouTube is for long form, deep explanatory videos that go on for at least 10 minutes to sometimes an hour. So it has a different targeted audience. Usually, patients who do this are like stuck in traffic and they're driving and they're just listening to your YouTube video. On Instagram, it's more visual. So people on Instagram are more visual, they're creative. They think first before they comment, they think first what they post. So these are, I think, patients who really want to go to your clinic. These are the patients who really go and see you. So TikTok is very different. It's very dynamic. It's usually the young crowd. You have to hook them in the first 3 seconds. Otherwise, they just scroll past you. Facebook, on the other hand, has an older demographic. So this is where you get the titas, so the aunties. So they are the ones who like shareable content. So when you post on Facebook, it has to be shareable. They will forward it to their friends, to their community. So Facebook is more community. So if you want to build community, you should be in Facebook. Now, the credibility framework. You have to understand that visibility is not credibility. It doesn't mean that just because you're there, you're credible. But it all starts with visibility. So visibility means you're being seen. And then when patients see you often, they start to recognize you. I remember that doctor. And then when you're consistent with what you post, you're believable, they start to trust you. That is credibility. And then they go to your clinic. So the goal as content creators should not be views. The goal as doctor content creators should be earn trust. There is what we call a credibility ladder. Of course, you start with your credentials. As dermatologists, as aesthetic practitioners, you have to know what you're talking about because trust is not claimed, it's earned. When you show up consistently and you give clear explanations, your content is like reasonable, and then that's when you become a trusted doctor. So these are the content pillars that I recommend for doctors, for those who are starting on social media. Go on education, talk about your topics that you know about, small bite-sized pieces. This is very, very important, debunking myths, because there aren't a lot of doctor content creators online. There are like 1:10,000, 1 doctors to 10,000 beauty influencers. You have to also maybe share what patients can expect during a treatment. You have to teach them who is a candidate for a certain procedure or not. And for me, it helps that you humanize your content. So occasionally, for those who know me, I do a lot of, not a lot, but a few like funny contents that's unrelated to doctor medicine, just to help with exposure and engagement. So what are the types of content that builds trust before consultation? So I tell patients what I say to my patients before doing lasers, when I would not inject fillers, when your melasma keeps coming back. So these are examples of content that you can actually make. And AI is a very, very helpful tool when making and creating content. But what I have to tell you is that, I am not a full-time content creator. I am not available 24/7 for diagnosis via DMs. I do not share my whole life online. I have an entirely different life outside of social media. I am not immune to criticisms, pressure, or fatigue. And I am not an influencer first. I am a doctor first. So what I do now is I have a team. I have a team of 7. Marketing, one who takes videos, photos, one who posts. And what I do is twice a month, I have 2 shoot days. I shoot anywhere from 10 to 20 videos on those 2 days, and I have my team edit and post everything. But all the content has to go through me. The script writing is me. So the hard part is the editing. And this is what you have to know, and I think that this is worth saying. There are a lot of things that goes behind the scenes that people don't see. So when you're on social media, you have to be immune to like bashers. I've had a lot of there are a lot of people online who say really bad things because I think they get a kick out of it. So now, social media and the consultation room. The consultation, again, like I said, has changed. I'm sure you've encountered patients who tell you, oh, but doctor, I saw on TikTok that this one does this and that. ChatGPT told me that this. So you have to be ready for these kinds of questions. Before, when that started, I used to get offended. I'm like, why did you even come to me? Why don't you just go consult Google and ChatGPT? But I don't think that's the right way to approach it because, I mean, we do that for other things too. We consult AI too. So it's not a place to be defensive and offended. So how educational content improved consultation efficiency? I changed my mindset by thinking that an educated patient actually leads to a better consultation. They ask the right questions, they have a background of what they want to know and what they're feeling, and better conversations actually lead to better outcomes. Because when patients ask the right questions, they have things that, oh, might have forgotten to ask, then later on you might be addressing things that you might not even be thinking about when you're doing the consultation. So this one, from parasocial familiarity to professional's trust. So usually when patients find you online, they feel comfortable with you. And they tell you, oh, doctor, you sound like what I see you on the videos. So they feel comfortable. And they open up to you more, they trust you. But it's very, very important to set boundaries. So now we go to ethics, boundaries, and professionalism. There is a, how do you say it, difficult way of balancing ethics and, what you present on social media. Of course, there are a lot of benefits, but there are a lot of risks. Sometimes, especially in platforms like TikTok, you need to present all the information in 30 to 60 seconds. So there's a danger of oversimplification. There's also a danger of public misunderstanding. So you have to weigh all of these. And in the Philippines, the top two most active social media platforms are Facebook and TikTok. I know it's different in other areas. I know in Vietnam it's TikTok. I know in other countries it's Instagram. But this one you have to really consider because the bigger your reach, and doctors said it earlier, the higher your responsibility. And I agree. So my non-negotiables online, I do not diagnose in comments because you will get that. Doctor, I have this, what do I have? I do not do consultations through DMs. You will find that patients send you their photos, even photos of intimate parts, and ask you to diagnose and consult. So I don't do that. I don't also accept photos sent by patients for consultation, even if they are already my patients. I protect patient privacy, and I always get consent before I post anything online. If ever you are doing partnerships and collabs, it's very important to disclose them. And you have to explain risks and limitations to your patients and not just the benefits. Do not overpromise outcomes and always stay professional and consistent across all platforms. Now, for you guys who want to be on social media, how can you build a trustworthy online presence? This is my strategic social media model. I won't go through it anymore. You can take a picture. But it's very, very important to identify who your audience is. So some doctors go online because they want to target fellow doctors. They teach how to inject, what lasers to do. Other doctors, like myself, target patients. So it's going to be very, very different. And you have to know that before you start. Otherwise, your audience will get confused. Next, this is my tip, the 4C framework for physician content. You have to be clear in your messaging, understandable and simple, not watered down, not oversimplified. You have to be credible. Everything that you post online should have evidence or should have backing. And you have to also be culturally aware. Before, when I started on social media, I wanted to target the world. It didn't work. So now my content is more focused on the local audience. I speak a mix of English and Tagalog, and I make sure that it's culturally relevant to my audience. And of course, we should be clinically bounded. What you say online should never be a substitute for proper care. So always my call to action when I make videos at the end is consult a dermatologist or a doctor. And here, making content culturally relevant to Asia, I think there are quite a bit of similarities between the Philippines and, like, say, Thailand or Indonesia. But there are a lot of difference. So in Southeast Asia, there are a lot of skin of color concerns. Patients want to look natural. They don't want to look like someone else. They want to look like themselves. And these are also important. So for content formats that work, short-form videos, these are the #1 drivers. So usually like anywhere from 7 seconds to like 30-second videos work. Carousels also work specifically in Instagram. Long form if you're targeting to make content on YouTube. And then you can also join lives, webinars, and community posts. So remember to practice growth without losing professionalism. So benefits of being on social media: you get more informed inquiries, you get stronger brand recall, you have more aligned consultation, and you get a lot of referrals and visibility. However, you have to also protect yourself and set boundaries. So remember that having boundaries, it does not mean that you don't want to help your patients. It's just protecting yourself and your privacy. So, practical workflow for doctors who want to be on social media. I'm not going to go through this anymore. You can just take a picture. But the best content ideas usually come from the consultation room. So, when I'm in the clinic, I have a notebook right next to me. And anytime an idea comes, like for example, an interesting problem or interesting consultation, I write it down. And later on, when I'm going to make my content, I go back to that notebook, and that's where I generate my ideas. So what I learned from my being on social media, so lessons from my own journey, consistency outperforms virality. Your audience learns your clinical philosophy over time. Patients can sense authenticity. So you have to be the same in clinic and on your social media platforms. And our role as physicians are to be filters. You have to filter out the noise. You have to filter out everything that's wrong on social media. You have to correct misinformation. And actually, that's a very, very big responsibility. But we are in need of a lot of professional content creators, so I encourage everyone to be out there. So for my take-home message, visibility is not enough, virality is not enough, education is not enough. So you have to do all of these things to build trust and to build a good social media profile online. So these are my references, and with that, thank you very much.
Thank you very much. We continue? Yes. It's my pleasure now to introduce Dr. Rashmi Shetty, from dermatologist from Mumbai. It's cold, yes. It's cold.
Okay, if I'm shivering, it's not out of nervousness, it's cold. Okay, thank you so much. I'll teach you a trick to increase your social media followers. All of you have your mobiles? Get onto the mobile, search for Dr. Rashmi Shetty. Ocean, you
Well done.
yeah, just hit follow. All right, so no particular disclosure for this. So what I'm going to talk today and share is trust. Today, like all my predecessors spoke, there's a lot of clinics, there's a lot of doctors, everybody doing well. Everybody can buy an equipment today, and everybody has access to international education and to hobnob with the best of the best. I remember my days when we started aesthetic practice. Even to learn one technique was so difficult. Many of the techniques we almost did it on our own and grew up, right? But today everything is handed on a platform. So which means to say, what then is the differentiator? How and why will a patient choose you, and why will they stick to you? So to me, there are a couple of things. One, of course, is the experience that you give them, that you leave them with, so that stays with them. And that starts from the trust that you build with them. So what is trust? On a definition, it just is trust is a confident relationship that you build with an unknown. It's unknown, right? You come to your doctor, you don't know her or him. You just need to build that trust. Like Irene rightly said, probably you've all seen her on a social media, but beyond that, what do you know of her? You just have understood and read what she and others have spoken about themselves, but you don't know her. So it's the bond that you have to actually build with an unknown. Now, trust is also willing to be vulnerable to the other person's action. Imagine you're giving your face with another person's hand. You don't know how it's going to turn out, and you're going to have to live with it. So that's a very, very big decision, and that has to come from implicitly trusting your doctor. So how do we go about it? Is trust the confidence that you show to your patient? Maybe not. Is trust your popularity? Maybe not. Is trust the social media following that you already have? Again, maybe not. Then what is trust? So trust is credibility with intelligent humility as well. So that credibility you build with various things. I'm going to talk about it. You've already been spoken. Integrity. You have to be, integrity speaks before you speak. So keep it real, whatever, like they say, maybe seen on social media or seen on other platforms that they've already studied about you or read about you, has to be the same when they come to you. And what you deliver to them has to be with the highest order of integrity from your practicing perspective. And reliability. Imagine a patient comes to you very vulnerable, right? Like our psychology speaker also spoke to us saying that they're coming to you not just to make their skin all right. They're coming to you thinking you're going to give them that confidence. You're going to give them that probably happiness or joy that they have lost, or the love that they have lost from their husband or spouse. So they're coming to you not only for a clearer skin, they're also coming to you and laying their soul open to you. So they need to know that you're handling it well. So that also forms a trust building activity. So what is trust? Why does trust even exist as a word or a concept? That's because, as she rightly said, that there is so much information out there. The internet saying something, TikTok saying something, Google saying something, AI saying something. There is an overload of information. So for a patient to sit and decipher all that is practically impossible. So then what do they do with that overload? Trust that one person who they think from that will suss around and give me that information which is right for me and not necessarily right for the clinic's business. Right? So that is important. Therefore, trust exists because life is too complex. Trust is the brain's way of simplifying an overwhelmingly complex concept, right? So now trust is an anchor. The humans do not actually build from zero. They build it from somewhere. Usually it is transferred or borrowed. For example, transferred from the qualification they've put out, fellowships that you have earned, awards that you're talking about, your publications, social media presence, reviews, word of mouth, all of this. So they come to you through various things, and that's why they have even walked into your practice. There's some anchoring of trust is there. And then that gets improved by the way your clinical staff talks to them, by the way you talk to them, by the way the clinic looks, by the way the entire presentation is done before they walk into you. All of these little things build that trust. So we need to be very careful. The tone of your voice, your body language. You're speaking with your arms, with your hands open, makes them build the trust in you, not just type it out on a computer as they are talking to you. A lot of doctors do that today thanks to the softwares. They don't write the prescription, they don't look at the patient, they're already dishing it out looking at a typing forum. So that's not how it should be. You're remembering those little details. How's your daughter? How's your dad if he was not well? Those really. And yes, admitting the limitations. A lot of times, psoriasis may not be something that you're practicing for years now, and there may be another dermatologist who's better at that. So if your aesthetic patient comes to you and you want to say, I'll treat it all and I know the latest biologics, maybe that's not right. You refer it to a patient who's very good at vitiligo or psoriasis thereafter. So that vulnerability to say, this is my specialty and I know this best, is something they really trust you with. So don't hesitate to say, I'm not best at this, it's okay. So it's not, can you inject my fillers? It is, can I trust you with your sense of beauty or aesthetics or outcome? So a lot of times people come to you, you know, I was at an event 3 days ago and they were talking to me and they didn't know who I was, someone, and then I said, I'm a dermatologist. So she said, but you don't look like a dermatologist. Well, what does that even mean? So people are expecting us to look overfilled and probably overdone now. So the person who's sitting is judging your aesthetic outcome capabilities or analysis by how you look. So it's very important you bring that also. Patients rarely have the expertise to evaluate all the scientific knowledge that you put out, right? They're evaluating from what you said, from the human way that you look at them. There are a few facts. I just want you to note them and take them home and think through them easily. I mean, at leisure. Trust leaks from tiny moments. Trust is built in drops, but it is lost in buckets. Yeah? So to build the trust, it may take you years. One wrong move, one wrong way of dealing with a patient, you may just lose it. It's gone. So it's very important for you to remember that. And then it's very important that the patient today is judging you. Is the recommendation good for me, or is it the target for the clinic? Everybody knows now that there's a target. It's also treated like a business. So you need to be very, very wary how you recommend anything to a patient. So there are two types of trust, cognitive and affective. One done from the heart, one done from the brain. So the one from the heart is all mushy, how you treat me, how you're taking care of me, how did you smile, how was your body language. The one which comes from the trust is more data-driven. Yeah? So both has to be taken care of. This has already been told by her beautifully well. How do you build it all? Social media platforms, what you're writing on your website, what you're putting out, your reviews, all of that form the thing that the brain is assessing. But what happens with the heart? I just want you to see this video for a minute, if it plays. I'm on full volume. Sorry. Can I have full volume, please? Full volume. Full volume? Is this also fully volume, whatever? How do you do that? Ah, this was 0. Okay, I'm playing this for you guys. No volume. You know, there's no volume. I actually wanted you to listen to her words. So this was this patient who, you know, during the COVID times, we were supposed to record most our injections and send it to various conferences because that's the way we taught people. So I was recording an injection for her. She finished it, and actually my daughter was recording. And my daughter forgot to switch off after we finished injecting. So we accidentally recorded her reaction. And the last word she said was, she's around 45 or 55, I've forgotten. So she said, I thought my life was over. And you have no idea what you've done to me. Oh my God, my confidence is back. So when you hit that menopausal age or when you hit that 40 plus, we actually think it's vain, but I'm telling you that's devastating for people to see face change, structures change. You're not as beautiful as you were before. You don't get compliments anymore. Your younger child or your daughter's getting all the compliments. So suddenly everybody used to compliment you and now you don't get it. So a lot of, and maybe husband is not looking at you with those loving eyes. There's too much that's happening. So then for them, that aesthetic intervention is a lot more than just a line gone or a pigment gone. So yeah, that's where your whole heart comes from. Like I said, here it is. Feeling that you leave the patient with, feeling that she feels when she walks out of the door, the way your team handles them when they walk in, even if they have to give a form of anxiety and body dysmorphic, how you give it, at the accounts, how they deal it and how they give them the billing, all this leaves a beautiful, warm and mushy feeling. Important. Then again, these are another 2 terms I want you to think when you go back home. Thin slicing. This is a term in psychology which says within 50 seconds, a person has already assessed you. They have either trusted you or not trusted you. That's all it takes for your amygdala to decide whether she trusts you. So imagine. So I don't know what it takes. That's what you call a gut feeling. You look at a person, you love them or you hate them. So that is thin slicing. So remember that. I don't know how you make the thin slice happen, but you see if that can be happened. Yeah? The other is the halo effect. If you don't like what you saw in that thin slice, it's a halo. It carries on. You don't then like her way she spoke. You don't then like the way the secretary spoke. You don't like what she did. But if you love her, she might do some horrible things to you. You will still trust her and you will love her. So it's a halo effect which continues. So that thin slicing is your chance. I don't know how you make it happen. Yeah? So complications damage confidence while dishonesty damages the trust. You could have a complication. You will only damage the confidence of the patient in you maybe, but they'll come back to you. But if you're dishonest with them, you've just lost the whole trust that they have. And then once a complication happens, if you're very defensive, you're concealing it with something else, lack of accountability, all of this leads to mistrust, not the complication itself. How you handle it is very important. So this is something which was very beautiful. He says, trust doesn't mean that you trust that someone won't screw up. It means you trust them even when they do screw up. That is where this trust flows. You know, there was this American study which they did where, who is the doctor who sued most? Not the doctor who did the most complications. The doctor who didn't treat the patient well in terms of warm and fuzzy feeling. The doctor who made them wait longer time at the waiting room were the ones who had more chances of getting sued. So it's never the complication or wrongdoing or screwing up. It's how you deal with it thereafter. A lot is said in the unsaid. Time done? Done. Last one, this is. In an age of algorithms, influencers, endless information, trust may be the last competitive advantage you may have over the others. Thank you.
Thank you very much. That was a really nice ending. Next, we have Dr. Noura Lebar from Italy talking about the spiritualization of our daily practice. It's not going here, so no worries.
Can I use the microphone? Can I use your microphone? Because I like to move a little bit when I work. So I have been thinking since long time to give this lecture actually. Because recently, you know, I'm practicing since almost 17 years. I don't want you to focus on the slide, but more on to feeling me, okay? So seriously, because it's all spirituality. It's about not about what you see with your eyes, but what you feel. So then I switch my. At the beginning, you want to be famous, you want to have patience, you want to have good results, satisfaction, and so on. But then you really spiritualize your practice. You see how there is some beautiful relation, love with your patient, trust. She will come to you just to be with you, to feel your energy, to feel comfort. And thank you. This is amazing. It's because I was really in. Just a small biography about myself. I'm teaching at the university. I'm professor at the University of Genova since 10 years in Italy. I'm practicing between Italy and Dubai, and that's it. So I would start with this quote. So the French one would say, "Science sans conscience n'est que ruine de l'âme." The translation, François Rabelais. The translation would be, "Science without consciousness is the death of the soul." So for me, it was extremely important to just preserve the natural beauty of my patient, never overdo, never propose to them any treatment that doesn't suit to them. So if you see this patient at 72 years old, in 2026, she looks younger than actually in 2012 when she was 58. And she's a doctor actually. See her jawline, no surgery has been done. So that's how you build the trust. They want to have natural results. They want to look fresh. Can you remove the sound totally? No sound from the video? And so you can treat her full face. The most important that when you have young patient coming to your practice, don't overfill them. Like I use for her maximum of 2.5 ml, and the difference is really obvious. Also, this patient, I did a full face. Nice voice. Thank you so much. So, nose filler, cheeks filler, lips. I love to show my results at the same time, the video and the treatment on the same patient. And where we have the time to see, because we can't see even here, just to be on time now. Okay, I can see it. So it's all about a very natural look, to use the minimum quantity of product. Be aware of that, especially when they're young. You don't want to overfill them. If, for example, for this patient, you can see this amazing result only with 2.5 ml. Lips, cheeks, and the jawline has been done with Nefertiti with the botulinum toxin. So I want to show what I want to have on my patient, that also you can also really change, be life-changing for this patient. And don't forget to sometimes to provide treatment for free for patients who can't offer it, okay? For example, for this patient, you know, she's not from rich family, so I propose to do for her for free. So please put charity on your daily practice. It depends. If you live in Singapore, I don't think that you have a very poor patient. But wherever you are, just even this patient, I did her for free. But look, just half hour of my time, you change life. You can be life-changing for her, and she's also only 16 years old. So include that in your practice. This is my patient. That's what I'm telling you. She's coming to me wherever I am. She's spending even time with me in holiday because that's a love relationship that is created. Trust, love, and she feels confident. Look at her amazing jawline at 18. So this is the same patient because I want to show you. I combine treatment just to have, and look, you will see the smile on her face at the end of the treatment. See, that's what I love. This is the best gift I could have from my patient. Okay, so this is another one, 2018 until 2026. So it's fine. Give them amazing results. They will come back to you. They will love you. They will follow you wherever I'm. Like they come, I'm Dubai, she coming to me. Where are you? I'm coming. I need to get my treatment done. So that's what you need to do. Give them the best. Give them natural results. Don't transform them. And then let's go now into, I don't want to see that results, that pillow faces. It's really not aesthetic at all. So now we are, of course, in the new era of natural regeneration, not masking aging anymore. And now let's go into it. Why ethics matter. First, because of the growth of aesthetic medicine. Then the social media pressure. So we know that in 2030, the market of aesthetic medicine, only in US, it will be at around $90 billion. Do you imagine what is it? So, and also we have this social media pressure. There is a patient who will come to you. I saw this on TikTok, on Instagram, on my friend does this. What is it? If you want to make money with your job, you can really make a lot of. Wherever you go, they will ask you, they will need you. But please do it with consciousness. It's very easy to have. So what does it mean, the ethics? It's to see the whole person, not that detached. You want lips, you're going to see her lips. Presence, empathy, compassion, human-centered care. Okay, so, and the 4 pillars, always keep in mind, wherever you have beneficences, non-maleficences, autonomy, and justice. So be really sure of what you want to give to your patient. And why it's challenging to have ethics daily? Because patients have unrealistic and realistic expectation, and they have this body dysmorphic concern, and they do over-treatment, they have this commercial pressure, they don't even know. Then you need to guide them. You need to guide them toward the best procedure. Then, the ethics of beauty are type of harmony over perfection. So you're not looking for perfection, we're looking just for harmony. Beauty by harmony. And preserve the identity of the patient. Don't overchange their face. And respect diversity. If she has an ethnic, like she's Asian, don't make her like European. Don't over-project her nose. Even if she asks it to you, don't do that. No, I want to preserve you. I don't recognize them. But then they don't recognize themselves. And the intention also is important. You need to understand why this patient is seeking for an aesthetic procedure. It's coming from a real need, or just psychological. What should she want to, to follow the crowd and to do like others? And ask yourself, will it improve the quality of her life? Yes or no? Would I recommend it for myself and for my family? Yes or no? In fact, you see lots of surgeons, you see lots of injectors, they don't do anything on themselves, but maybe they can overdo for other patients if they ask them to, if they pay a lot of money. So, and also, we, from injector, we become type of healers. I'm not bothering you coming up, you can see, right? I like to move. So, at the same time, that your technical excellence needs to match your empathy and listening as a therapy, trust and safety. What does it mean, listening as a therapy? So sometimes the patient will come to me, she will just stay with me, or talk to me and they say, oh my God, I have the best job in the world because I inject her. It's painful what I'm doing to her. She's paying me a lot of money. She trusts me. I have a beautiful connection. And then after all of this, she's kissing me and paying me. So this is amazing. But really listen to her from your heart. So here I can translate you the message that the patient told me, if I told him, even if some doctor, he loves Italian, but he will not understand. Buongiorno dottoressa, volevo ringraziarti per il tuo magico lavoro. I wanted to thank you for your wonderful, magical work. I'm amazing, I'm feeling amazing. I don't have bruising. I love the result. It's very, very natural. And everything whatever you need, please ask me, I will help you. So you have this relation, this that creates between you and the patient, relation of trust, of love, of sharing, of help, of compassion, and so on. So you become also her confidant. This is my way to say things. Like what I see as, I'm not seeing it as a business, actually, when I inject, when I have a contact with the patient, because you go into a lot of intimacy with this patient. And why to say no? Yes, many times I say no. Your lips are already you have a lot of volume. I will not touch you. You can go to someone else. And what other doctors they tell? My colleagues, they say, anyhow, they will go to someone else. They will pay someone. I don't care, but I will not take the responsibility to overfill them. This is the case of a patient. She texted me. She's 26 years old. She wanted a surgical lifting of eyebrows. I want the foxy eyes. Look all the procedures she did. Already at 26 years old, surgical rhinoplasty, surgical full body, contouring, liposuction, full face fillers. So I said, no, I'm sorry, I will not treat you. So, as a conclusion, every injection carries an emotion. In science plus ethics, compassion. These three pillars, hello. Welcome back. Okay, so I just want to specify a very important thing. So when I was younger, I was looking more into external fulfillment, the show up, and so on. But then I get to know, reading this book, I don't know if you know about The Power of Now, it's really amazing. Give me just 2 minutes. So looking outside ourselves for fulfillment, I still have 1 minute. For fulfillment, turn us into beggars, always grasping, never whole. And you really need to look within yourself, as you know, Antoine Saint-Exupéry, who says, on ne voit bien qu'avec le cœur, l'essentiel est invisible aux yeux. One sees clearly only with the heart. What is essential is invisible to the eyes. So do meditation, go within you, because spirituality helps you to stay connected to your inner soul, which is ageless. It will give you also a lot of insight to be creative, and which is the best part, the best intuition that you can have, the best creativity. Here you can see from 2008 until 2026, there is no too much difference, because I work on spirituality. It really helps me to be connected with myself, and it helps you to be creative. So I start painting, and you can all of us, we can do this. So thank you so much. I'm gonna conclude. Thank you so much for your attention, and remember, whatever you do in life, do it with love, and you will be always blessed and successful. Thank you so
very
much.
much, Dr. Lebar. Very insightful. Dr. Jan Raymond Conodera, last but not least, from the Philippines again. Very interesting. We got so many Filipino talks here.
Thank you. I think I'm a doctor
amazing.
here in the Philippines. No, I'm not a doctor. I'm a creative director and marketing specialist. So from spirituality, we are talking to death right now. The death of influencer marketing. And I want to update Dr. Antonio because he doesn't have any social media. So this is what's happening in social media right now. Okay. Yes, I'm a graduate of information technology and with a background of art direction and clinic marketing for Lift Aesthetic Clinic. And I'm also a distributor of Aptos in the Philippines. I'm a speaker for major conferences. So these are my backgrounds, and this is what's happening to social media right now. The old and the new, the cringy and the actual, which is happening to every social media of aesthetics right now. So for 8 years, I've been marketing campaigns, choosing influencers, contracts with ambassadors, and also discovering new models, dealing with celebrities and PR work. So what I discovered in my 8-year practice is that influencer marketing is just renting someone's audience to sell your product. It's basically fake. The influencers, they pay, they get paid, they post, and they forget, not even trying the product. The problem, authenticity, budget, no loyalty at all. If you notice, influencer, they're quite sketchy. In a way, they go to one clinic, they go to one clinic, they go to one clinic, and basically promoting every clinic they want to be. And getting free procedures as well. Delay on posting and content since it's scheduled, or any delay on producing, and I'm not really a fan of following up. Once you do the procedure, I think it's automatic that you have to post it. right? Values that doesn't align with the brand. So why death? It's a death of influencer marketing because it stopped working. Audience fatigue, tired of seeing the same post, templated conversions. They may have a lot of followers, but sales and conversion, it's very low. Okay? The content is very templated, it's the same. So from borrowing trust to building it. So what's the difference about influencer marketing and the one that you're doing in your clinic right now? Influencer marketing rents an audience. Doctors who talks about expertise, science, safety, owns an audience. Influencer marketing borrows credibility. Doctors who speaks about personal branding, products, opinions, earned authority, and so on. Campaign-based, personal branding is compound and it flows. There's a, I would say, specific story that is continuous when you are speaking about clinic. Whereas influencer marketing, it depends on the brand that you're receiving, right? And of course, influencer marketing, they are paid to do it. So there is a sales proponent because they want to sell behind it. But personal branding, you are more of a service. You want to inform the public that this is the safety, this is what I think that works in your face, and this is coming from an expert advice. So this is like a social responsibility. All right? So my recommendation is invest on your personal branding. So doctors who are posting about contents, about their opinions, about their practice, please give yourself a big round of applause because you're doing it correctly. So informative videos about safety, product science and benefits, these are the ones who are high yield in terms of views. Before and after video photos and awards, please post that. Conventions you've attended, like you have attended here, you IMCAS, you're talking here, you've met amazing and excellent doctors, what you learned, you post about it. It's about credibility. Conventions attended and presentations. Also, you need to have connections. It's not about like being the best. It's not about being credible. It's not about being on top and being an expert. But show your connections, show your human side. Interests, hobbies, and travels. Show credibility, expertise, recognitions, but show human connection. Choose 4 authentic personalities. It is highly specialized in their own brand. Of course, besides you doing personal branding as a doctor, is you can actually invite collaborators. And I would not suggest getting an influencer, but more on a personality that is highly specialized on their brand. Who? Clients. Invite your clients to speak about the journey, can share about the journey and the procedure. I would suggest, this is very strategic, invite a news host or TV host to be your collaborator. Do a free procedure on her, and she can invite you to a guest, and then that's a big save, depending on your marketing budget. And she will be saying your name after each shows. That is where marketing happens. Also, invite a makeup artist to do a procedure, and then these makeup artists, for their clients, they will recommend the best procedure and basically the best clinic for it. Fashion magazines are very, fashion magazine and models, these are high yield because they capitalize on their look. So if you do models, they will talk about it, their experience, and they would share how great you are as an injector or a doctor. So the current situation right now is viewers now trust authority more than influence. 72% prefers content recognition, recognized specialists over paid influencers. It's 3 times to trust a domain expert or specialized doctor more than a celebrity. And 48% of consumers, they actively distrust overly branded influencer content. So viewers right now, like us, are very smart when we see one, we know it's paid. Who actually does trust more is a specialist who is expert on their brand. And the second one is a peer user reviews, and the third is a micro-influencer. So where do patients mostly discover trust in the clinic? Doctor's personal content when you post in your personal social media or in the clinic. Patient referral of mouth, of course, that's still one of the best traditional marketing. Conferences, masterclass, and presence. Influencers' recommendation is very low, and celebrity endorsement is another celebrity endorsement. The big problem what we're facing right now is about influencers. Marketing that is no longer proper or ethical. These influencers, they teach how to inject for peptides. Can you believe that? That's crazy. In the Philippines, the government is doing efforts right now to take out these influencers who are selling online the peptides, and they would show how to inject it, and they will recommend more like a doctor. So influencers are promoting unregulated and approved weight loss or biohacking injectables for skin improvement and regenerative medicine. And as professionals, clinic marketers, doctors with ethical values, you should share information and educational content among followers about regulated and unregulated products. Talk about safety and risk, and only recommend FDA-approved products and procedures. Thank you.
Thank you very much for staying on time. Thank you for the insights from a non-doctor. Are there any questions in the audience? If not, I have a question for Irene Gale, if you allow. You said before you entered the stage that you'd like to excuse yourself for your colorful slides because this is who you are on social media. And then on one of your last slides, you said that you need to be consistent. You need to be the person in clinics that you are on social media, obviously, because this is like a personality you represent to your clients, to your patients. Are you different in private?
Sorry, I meant to say this is not social media. I was nervous.
Okay.
Yeah.
Because I think that's a
Yes,
very
yes.
interesting
Yes, correct.
thing, though. Because I've got several colleagues, several friends that I know privately quite well that have a huge social media presence, and they have developed themselves towards the person they wanted to be on social media, and privately they are kind of trapped in that persona. That's why I was asking whether you are someone else.
I'm the same. Yeah, and my friends
Very
attest
good.
to that. Yeah. Yeah, and then my patients tell me that when they talk to me during consultation, they're like, "Oh, I'm imagining myself watching you right now, but you're in front of me." And I think that's very important. You have to stay authentic to yourself. And what I teach my younger doctors is that it's very important that you treat everyone the same. So it doesn't matter if it's like some VIP patient or some ordinary 25-year-old who just walked in your clinic. You have to treat everyone the same. No filters, just the same you. It makes life easier.
Thank you. Another question to you. I've heard the statement today in one of the talks, I thought my life was over. What do you think from a psychological aspect to that statement? Do you think that would have happened? Yeah, no offense, not at all, but I think it's really interesting.
Yeah.
How would you deal with someone like that? If you hear that kind of statement, to me, that's a big red flag.
Okay. Okay. That was in context of your patient, and that came out after feeling happy, and I thought my life was over. I think the context of that was that it's almost the feeling I got. The world, like a new chapter was opened because a new world of possibility was opened because of that. My interpretation, I thought my life was over, didn't mean that, I'm dead. My life was over is that this is the routine already and nothing is going to improve anymore. My interpretation for that, there's another door, another chapter to go into. I find it interesting that you picked up on that, and I think that's why I think the context for everything, the words especially, I'm very sensitive to words, and I choose very well the words, and I do agree the way you say it. As I had explained, I'm a trauma-oriented psychiatrist, and because of that, I'm also guided by trauma-oriented care, meaning to say, the person I'm talking to, I'm assuming has trauma, and therefore, my words, my pace of speaking, even my modulation, is attuned not to trigger trauma as well. And that's why it's very important. So going back to your question, I thought my life was over. I didn't feel it was, from the context there, I didn't personally feel she was suicidal or anything. I felt she was stuck. Her life was routinary, and all of a sudden, boy, it opened up a new colorful world. And that is, I think, the healing thing that we've been talking about. It's not just the filler per se, but it's also part of the magic, which I think we also have to articulate here, and you actually mentioned in your lecture, the social. Our brain is actually, we're designed, we as a species did not live to be in isolation. We're designed to be social beings. That's why social media is really an extension of that social brain, and that's very important. The reason why I do not in social media is because I think it takes too much of my bandwidth to focus on that. I prefer to focus on other things. So that was my deliberate decision to do so. So thank you, actually, because from your lecture, it was like the overarching, you gave the framework for the other lectures that came in.
I want to extend something with your permission. So, you know, he's amazing. So he analyzed it spot on, because this is exactly what she was going through. She was unhappy in the job that she was. She was single, if I remember right. She didn't have kids. She didn't like the way she was looking at that time. The minute we finished this, she went on to get herself a job in US, a dream job in a dream company that she wanted to. She travels world across now, single, alone travel, and she keeps sending me pictures to say, how wonderful. And trust me, after that, maybe I saw her 3 years later when she came back to India once and didn't do a whole lot of work, but a little bit of work. She's in touch with me, and she is so happy. Like he rightly said, the idea was to say, she thought this was it. Suddenly that opened a door of more possibilities and potential and extension of a youthful, happy possibility, maybe attracting love, fortune, everything.
Yeah.
So that is what it is. It's like, yeah. That's
Yeah, we all are healing agents. I think that is something we also have to internalize. As a doctor, I personally was uncomfortable saying that I heal, but I think as I matured, that's also, we're also electronic beings. You know, all the synapses are electronic. But let us not forget, are we physical beings having a spiritual experience, or are we spiritual beings having a physical experience? So thank you. This was a very stimulating discussion. Yes, ma'am.
No, this is like, you know, we learn, let's say, injectable and go home and think, any patient I want to inject. So this is like you understand something is depressive, not everybody is depressive and ready to die.
Thank you. Yes.
That's okay.
Yes, sir. Yeah.
Want to conclude?
You want to, are there any more questions? We got 7 more minutes, or are we all cold and want to get to dinner?
Oh, there's a, yes.
Thank you everyone for the wonderful ways of teaching us how to build content. I think every talk was inspirational on its own. So just a small question.
Speak in the micro, please.
Oh,
Yes.
just a small question. When you make content, and when you make wonderful content, you give us so many ideas to make content. Do you leave it organically to float on the beta space, or do you put in ad spend? Yeah.
For my personal page, I never put ads. But for my clinic page, I do.
All right. So you spend ad spend on your clinics, and I think Jan can also add to that. He would be doing that. Is there a metric for the return on dollar that you get? And also, what are the sort of conversions which are considered healthy conversions? From marketing for over 3 years now, I have understood that followers mean nothing, likes mean nothing. It's the number of conversions you have, right? So what does a good conversion count seem to you?
Well, I do a lot of ads because I'm a graduate of IT. So I think my strength is really information technology and the social media. There's no direct conversion ad. Well, it's a sales thing at the end of the day. When you reach a lot of numbers and your ad reaches a lot of viewers, a lot of messages, and it converts to at least like 50% inquiry, and then the conversion for, let's say, the actual procedure will be 20, but it depends on the effort of how you answer your social media inquiries. It's a quality of how you convince. It's a quality of how your tone as someone who speaks towards a client, and it matters. So that's how it works. At least 20%. Yes, yes, yes.
So before you, I just want to answer. So for me, I have professionals who handle that for me because I'm not a marketing expert. But in terms of conversion, it really matters how your staff answers. Because when you put an ad, a lot of patients will be interested. They'll ask questions. But if your secretary or whoever answers just says yes or no, whatever, it's not going to convert. So I think the best person to train for that is your staff.
I would love just to add one thing, that I know that the social media and everything, they give a fake image of ourselves, but let's try to be the most truthful possible. As you said, the tone of voice, all of these things, just be yourself, okay? And we need to remember that we are still doctors. We don't do business. We will not like show treatment on Instagram. And by the way, when you overdo publicity and marketing, you attract the wrong patient. Trust me, they will give you more headache than any money ever. You would like to give them back their money. So I usually almost don't advertise. I go like just by trust, One friend will say to her other friend and so on. It is the best quality of patient you can have. Don't forget, we are still doctors, okay? We shouldn't keep posting non-insightful things, like they keep doing some dances on the things. Like, it doesn't make sense. You're the first, but you with your husband. Like in the clinic, just to have more show, more visualization. Doesn't make sense.
I would like to respond to that. No, in connection to the presentation of Dr. Gail, if you've shown, and she addresses that perfectly because she mentioned a couple of times that we are doctors first. But I guess like as doctors, we're trying to utilize something that's really very effective to get our message across. I think especially for Gail, which I admire mostly, is her ability to educate. No? So not only educating co-doctors, but I think mostly now you're educating patients, right? And she's educating the right things. And that's why I love her being there. So that's why stay there. But at the same time, yeah. Yes, exactly. Because we have all our pseudo-influencers, our doctor gym trainers, who are, and people believe them. If we will not fight in social media, we will be overrun by them.
I think,
Right.
Jan,
But we have to do it
just
correctly.
said a very, very good thing, and that is a really good closing word because we have to finish now. It's the human connection. And I think we can all agree on that while in all of our jobs, the technical aspects are important, the non-technical are as
The
least
human
as
are
important.
essential. Thank you.
Thank you very much,
Amazing work.
everyone. And have a great evening. Thank you.